Is there a stamp for me to put this? Okay, where is the remove? Okay.
溫樹山
就呢度係咪？呢度 start。呢度前面，呢種個係 OK。
呢個係 bell。
哦，this is bell。
Dr. Chia, how would you like me to introduce you? Yeah, but Dr. Chia, and then your title. Your title.
I'm PhD on virus and immunology.
PhD.
University of Toronto.
Okay, PhD on virus and immunology. Oh, that. Good afternoon, ladies and gentlemen. Welcome to our first talk on immunization, infectious respiratory viruses. Our speaker for today is Dr. Kiam Chia, who is PhD in viruses and immunology from the University of Toronto. So let's welcome him with applause.
Well, thank you. Thank you, Angela, and then thank you, Dr. Cheung. Well, ladies and gentlemen, today I'm very pleased that I have the opportunity to introduce about the infectious viruses to you. And as we know that currently, the virus, the respiratory virus disease is around Toronto. Actually, it's already become a kind of pandemic. The pandemic started with the COVID-19, that is the SARS-CoV-2 virus, started from China. And this virus was first detected in China. Might not be necessarily from China. It just only was detected in China. And the same virus had been circulated in the whole world. And the first virus that China was discovered was also in circulation in Europe also. In fact, back in 2019, September sometime, when people look back on the serum collected from people who have a respiratory disease and found that a lot of people that do have antibody against COVID-2 virus also. So that this is an indication that the virus might not be from China. It maybe it's from Europe, okay? So, and also, well, this is the virus COVID-19. COVID-19, this virus is called SARS-CoV-2. And today, we have found that here in North America, there is the viral respiratory disease. This disease is due to 3 types of the infectious respiratory virus. Besides the number 2, SARS-CoV-2, there is influenza and there is a respiratory syncytial virus. These 3 infectious respiratory viruses are very vicious, and this is really affect our health system in Canada, in North America. These 3 viruses, they are share a lot of similarity in their clinical symptoms. This including they are causing the similar respiratory symptoms. They are highly contagious, and they increase transmission in the winter month. However, these 3 viruses, although they have clinically look very similar, but their genome and the virus particle structure are quite different. I need help. Where is that? Have the face here? Maybe you control it for me. The second slide, please. Okay. Well, what I will do is that although now most of you are very concerned about the COVID-19, and but this pandemic also include recently also include influenza virus. The influenza virus is very serious respiratory virus. It affects a lot of people, and the influenza virus have a long history. That means the virus is not just like COVID-19. COVID-19, they call it as a new COVID, respiratory virus, but influenza, you can trace it back into 100 and 200 years ago. At a long, long time ago, that means okay, the pandemic started, influenza pandemic started in about, in the record that you can trace it back, is about 130 or 150 years ago. At that time, the virus, the influenza virus, caused a flu, very severe flu. That means people who got the infection, usually the infection usually start from the respiratory, start from your mouth, from your nose, or from your mouth. Then, once the virus get into our respiratory system, especially on the upper part of the respiratory system, okay, good. Can you get rid of this thing? Okay, the virus respiratory syndrome. This, first of all, maybe I will introduce to you about this respiratory structure. In here, from the slide here on the right-hand side here, you can see that our human respiratory syndrome can be divided into 2 parts. One is the upper respiratory. The other part is the lower respiratory. Okay, so we call it as upper respiratory tract and the lower respiratory tract. There are different types of the virus attack our respiratory system. The most common one that all of the infection, when get into your respiratory system, all the virus started from the upper respiratory. So when it started upper respiratory, the very common viruses are rhinovirus, coronavirus, our SARS-CoV-2 is one of the coronavirus. And the enterovirus is a Coxsackie virus, ecovirus. Those are enterovirus. And also, you all might also know that called poliovirus. You heard about polio? Poliovirus is also an enterovirus too. But some of the enterovirus, they start the infection from the upper respiratory. And then there is a parainfluenza and respiratory syncytia, adenovirus, and influenza virus. I have put this in blue, is just wanted to highlight the three viruses that I'm going to talk about. It's the coronavirus, respiratory syncytia virus, and the influenza virus. In here, all the viruses started from our upper respiratory. 90%, 80 to 90% of the virus, when they started to infect our upper respiratory, depend on the ability of this virus. About 80 to 90% of the virus are not able to establish their infection in our upper respiratory. It's only 10 to 15% are able to overcome our upper respiratory system and go inside to our trachea and into our lung. It causes tracheitis, bronchitis, bronchitis, and the pneumonia. Only 10 to 15% able to go down there. Why they are not able to go down there? It is because in nature, we all have a very strong immune system, especially our natural immune system. This natural immune system prevented the virus to come and infect us, prevented the virus to go down from the upper respiratory into the lower respiratory. In Chinese traditional medicine, they have a philosophy. They say, as long as you are, this is what they call 正气存内，外邪不干。正气, that means it's the immune system. If your immune system is strong enough, in your body, you have a lot of 正气, the immune system, strong immune system, you will be able to prevent all these viruses to go into our lower respiratory. So this is what the traditional Chinese medicine, their philosophy about it. Now, all these viruses, once they are able to overcome our natural immune system in our upper respiratory, they will be able to go into the lower respiratory and cause the severe disease. Today, we are facing three types of the virus. These three types of the virus, they initiated their infection from our upper respiratory. They are able to overcome our 正气, our immune system, natural immune system, so that they are able to go into the lower respiratory. These are the three viruses. Okay. Now, these three viruses are influenza virus, called SARS-CoV-2 virus, and the respiratory syncytia virus. These three viruses, they are different. They have the similar clinical symptom, but their structure and their genomic makeup is quite different. Influenza virus is a negative RNA virus. SARS-CoV-2, the one that we are facing, the ongoing pandemic one, is a positive sense RNA. The respiratory syncytial virus is a negative RNA virus. The reason I put down here, saying that what is positive, what is negative, the thing is that positive RNA virus, that means the virus, once they infect our body, the virus release the nuclear, their genome is called RNA, into our cell cytoplasm. And from the cytoplasm, they can directly to make the virus protein and form the virus particle and release from the infected cell, infect other healthy cell. The negative, such as influenza and the RSV, they are negative RNA. Negative RNA, that means they have to go into our cell nucleus. In the nucleus, they make into positive RNA, come back to the cytoplasm. From there, they make the virus particle. So that is the difference. So that in this case here, SARS-CoV-2 virus, they replicate much faster. They have escaped one more step. They don't have to go into the nucleus. So that in the very beginning, when Pfizer or Moderna, they have invented the messenger RNA vaccine, a lot of people are concerning whether or not this RNA nucleotide, this nuclear structure, will affect our human gene, whether the virus can incorporate into our DNA. They don't have to worry about it. Now, if you know that the virus is a positive RNA, that means the virus do not have to go into our nucleus. They can stay into the cytoplasm. Our DNA, our gene is inside the nucleus. The virus do not have to go there. Even if they are able to go there, if they are negative, when they get into the nucleus, they also do not integrate into our DNA. So this is a difference for RNA virus. Okay, now we compare the difference between these three viruses: SARS-CoV-2, influenza, and RSV. First of all, I should tell you that RSV is a very common virus. They are not too severe, not too infectious. In fact, they can cause severe disease only in baby, in the small, young children. Children less than 2 years old are very susceptible to RSV infection. If the children grow a bit older, they are quite resistant to the RSV infection. So this is RSV. But today, it's quite different. Recently, in the hospital, there is a lot of young children, they have RSV infection. Why? This is a common virus. Why they become so vicious, you know? So I will explain the reason to you but, later on. But today what I want to talk about mostly is the influenza virus first. If we have time, we can talk about further on the other. The influenza virus, the genome is the smallest virus. That means their gene structure. Okay, their gene structure is the smallest. Influenza is the negative. The difference on their genome structure is different from the RSV and the SARS-CoV-2 is this virus, their RNA is divided into 8 segments, 8 of them. For influenza A, influenza B, they have 8 segments. For influenza C, they have 7 segments. Okay? So this is the main difference. But from here, you know that influenza C have only 7 segments, so they become not very infectious, very, very mild. It's only the influenza A and B can infect people. They are can be very vicious, suggesting that the segment number 8 is very important. The segment number 8 is the virus. This virus, they have the ability to against our interferon. Interferon is our natural immunity. Interferon in the Chinese medicine is our 正气, 真气. Okay? That means influenza A and B, they are able to suppress our 正气. Once our positive qi is being suppressed, then our cell will not able to fight against the virus. Okay? So the virus can get into their way. But again, our zhen qi is quite strong, although it's being affected, but depend on our ability, whether we can fight against the virus. So I suggested, like we have a pop-up vaccination clinic. Vaccination clinic is really to provide the vaccine to help you to develop the antibody against viruses. And although we have the vaccine for SARS-CoV-2, not influenza, but we should also get influenza vaccine. For influenza vaccine, you build out your antibody. This antibody is part of our 真气, our natural immune system, which will help our interferon to fight against the virus. Okay? So this is one of the benefits of being vaccinated. Now, the influenza virus, as I told you, that they have 8 fragments, their DNA, 8 of them. Okay, divided into 8. The SARS-CoV-2 have only 1, but this is a big one. It's about 30,000 base pair. And RSV is in between, only 15.2 kilobase. By the way, I also like to tell you, do you know how much of the nucleotide we have? The virus is only 30,000, the bigger one. Do you know how much we have? Human being? Anyone want to take a guess? Nobody want to guess. I will tell you the result. We have 3.3 billion of nucleotide. So that you see, this virus have only 30,000. We have 3.3 billion. You know, we have 3.3 billion of nucleotide, but we are invaded by this 30,000. In comparison, they are so small, but they can really fooling us around. You know, it's really unfair. Huh? Okay, now I will focus on the influenza virus. This is an influenza virus. The influenza virus is every year there is an influenza epidemic. Every year there is a epidemic. Sometimes there is a pandemic. Pandemic, that means it's the whole world. Epidemic is just only regional. Maybe in Canada only, North America only. This is an epidemic. The virus, every year, it costs about 200, this is in US only, 200,000 hospitalization. Especially, every year, it kills about 36,000 people. because of this influenza. So this is a serious infectious disease. The morphology is that this virus is only 80 to 120 nanometer. They can have a different shape. It can be round, spherical, elongated, just as here, elongated, or irregular in shape. This is the influenza virus. So, just now I said that influenza virus have 8 fragments of the, this 8 fragment of the gene. The most important in influenza virus, what we are looking at is 2 types of the membrane lipid antigen, lipid protein. One is a heme agglutinin, the other one, the new aluminate. So, heme agglutinin, we call it H. N is N. We have influenza infection. You heard about H1N1? H1N1, that means H type 1, N type 1. So this is how we identify the virus. If the virus causes an epidemic in our place, in us, we know that this is due to H1N1. This is the virus. We also heard about H3N2. These are the very common pathogen virus that is attacking us. H3N2, H1N1. These are the 2 very important. But now currently in here, I think just now somebody got a cold. Maybe he got this H3N2. Okay? Because if you have a cold, what you got is most likely 78% is due to this H3N2. And now today, in North America, only 22% are H1N1. H3N2 is the one. So, on this here, we are talking about the heme agglutinin and the new aluminate. This is the lipid membrane envelope protein. This is heme agglutinin and new aluminate. This is in the influenza virus. They are all together because this virus is very common, not just only in human. They are in the avian, on bird, domestic bird, and the wild bird. They are all, the H have a 18 type. The new aluminase is 11 type. So that when they are in a combination of this H and N, so from H1, it can pair with N1, N2, N3, N4, N11. H2, 1 to 11. So there's so many different types of the influenza virus is affecting us. But luckily, all these viruses are mostly in the bird. In human, we have only 3H and 2N. So today what we have is H3N2 and also H1N1. Okay. Now, just now I also mentioned about the virus character. The virus have a 7 to 8 segment. It's a negative thing, RNA. The nucleotide, this is their nucleus. You see there are 8 of them. They are numbered from 1 to 8. What is the significance of this nucleotide? Because all these nucleotides have a different function, especially this different function. Influenza have 3 types, influenza A, B, and C. All of the virus have 8 segments. Only A and B have 8 segments. C have only 7. All these segments, the segment number 2 is the RNA-dependent RNA polymerase. That means the virus needs this segment, number 2, to grow. So that in a lot of pharmaceutical companies, they wanted to invent a drug to control the virus infection. What is their target? Their target is this, number 2. This is number 2, is the virus that can grow their RNA. The virus needs the RNA in order to form the virus particle in order to be infectious. So that the number 2 is the one that it make the virus particle. So that if a drug against this, it will kill the virus. Okay? So segment number 2 is very important. Segment number 4 is the HA. We say that H1N1, H3N2, the H is controlled by this genome number 4. Number 6 is control the nucleotide, okay, new adenine. Number 8 is control the interferon. Interferon is our natural immunity. So that just now I said that the influenza C do not have number 8. That means they are not able to produce some substance to suppress our immune system. Okay? So that you see the influenza is a mild virus, A and B type, can cause full epidemic. Okay, now we say that the bird have a lot of influenza virus. Am I run out of time? 5 more minutes? Okay. Okay. I try to rush, okay. Now, in the bird have a lot of the influenza virus. All the virus, each of the virus have a different 8 segment of the RNA. Each one have a different one. When they have a different one, the virus, influenza, infect the same animal. The animal, if 2 viruses, these 2 or these 2, infect one animal, the animal will produce these two viruses in the bird. They will exchange their genome. They have 8 of them. I give you 2, you give me 5 or whatever, right? They change their genome so that there is a mixture of different kind of the genome. Then this is the new virus. If you have a vaccination against this one, that's not good enough. Because the virus can, you maybe have antibody against part of this, but they also pick up the genome from here. They can fight against your antibody, okay? Now, we know that in the wild bird, they have this kind, red one, the segment. In the domestic animal, our duck, turkey, or whatever, they have different type of the genome. But wild animal, duck, and our domestic duck, they become friends. They swim together. So that the virus it carry will infect this one. This one it carry the virus, also infect this one. So that what do they have? They have become a resortment of their of their genome. So they become a mix. There is dark and red together. So this is the kind of the mutation happen. And this mutation, if they infect the pig, we are always deal with the pig. When we infect the pig, the new virus will translate from the pig into human. Okay, this is the problem that we are facing. Okay, now, I will finish this one then. That's it. Okay, this is very important. In the past 133 years, there have been 6 flu pandemics. In 1889, there is a pandemic. And it was believed that it's due to H3N2. But also at the same time, they found that in that time, the flu also caused by coronavirus OC43. OC43, what is OC43? I would like to tell you, I think you guys have this book, right? This is what you paraphrase. In this book here, I have introduced about a virus. In here, this is your homework, maybe you can take a look at it. I have to tell you about the virus OC43. In this book here, this OC43 is a very mild virus, will not cause disease. It become a friend of us. When we got the infection, we have the antibody make against this virus, and the antibody will help us, prevent us from getting COVID-19, okay? But in 133 years ago, this, our friend, our virus, is a very nasty virus. It killed so many people in 133 years ago. But after the time passed by, come to 2002 or even 1900, this virus already become very mild. This is the same thing that we are facing the COVID-19 today. In the very beginning, the virus is so severe, especially in Delta. It transmits very fast and kill a lot of people. But now they become Omicron. Omicron, it calmed down a little bit. So hopefully, they will go further, and hopefully the COVID-19 will become very mild virus, just as 133 years ago, the human COVID OC43. Okay, this is one of the things here. In 1918, the virus changed into the H1N1. And then 57 changed to H2N2, but this Asian flu have not been around for a long, long time. But when they will come back, we don't know, but hopefully if they come back, will not be too severe. And then H3N2 flu. Now, another thing I would like to let you know. In 1889, when there was a Russian flu, and the virus was caused by H3N3, a lot of people got infected, and a lot of people also recovered from the infection, especially women who was pregnant. At that time, they got this H3N2 infection, and the woman developed antibody against H3N3. But because of the antibody, it will protect H3N2 infection, but will not protect people from H1N1 infection. 29 years later, there is a pandemic. It's called Spanish flu. It killed about 50 million people. Do you know that these 50 million people who died was due to the cytokine storm? Cytokine storm. It is due to because their mother, when they were pregnant with the baby in 1918, they are already 28 years old. But a lot of them got a very severe disease that they die from it. So this is the relationship between the two different viruses. Okay, and then now we are concerned that the virus from the animal, from the swine, from the bird, is H1N1. It came in 1996, and recently there's another virus, H7N9. They are also from the animal. Okay, I think that's. Okay, now we have so much worried about the flu. Yes, the WHO estimate that the flu season can kill a lot of people, but also we are so lucky that we have the vaccine available. The vaccine, it consists of 2 types of the influenza A, H1N1, H3N2, and 2 types of the influenza B. There is a new vaccine. It's called using the new technology, messenger RNA, to make the vaccine. This one consists about 20 H antigen. So if this one is successful, it should be able to protect us for a long, long time. Thank you very much.
Thank you. Thank you very much, Dr. Chia. Yeah. So afterwards, there will be a session of question and answer, and Dr. Chia can respond with Mandarin as well. But now, I would like to invite our next speaker, Dr. Ming Cheung, cardiologist, to speak.
This is the... Well, I'd like to welcome everybody to this presentation. I think Dr. Chia is a scholar and is a scientist, and he knows everything about immunology, everything about viruses. So did a great presentation. So what I'm going to do is I'm going to stay away from science, basically. I am not a specialist in COVID or viruses, not like Dr. Chow is. So I'm just going to show you some of the clinical significance of this disease and what you should know about the disease, okay? So I'm going to just very, very briefly, probably be much shorter than I could do it. This is, we're going to tell you about we're going to discuss something about vaccines and booster shots and also risk factors and treatments for COVID-19. What do I do? Oh, okay. So for now, many people are not interested or are afraid of doing or I have no interest in getting treatment or getting prevention vaccines or mainly because that many people think the COVID-19 pandemic is over. The reason is because a significant number of the public may have assumed that the pandemic is over. As you know, at one point everything is restricted, and public social distancing, mask, and everything else. But nowadays, if you go to a party, go to a convention, hardly anybody wears masks. I'm so glad you guys, most of you are wearing masks. Actually, everyone is wearing masks, which is very good. So that gives the public impression that the pandemic is over, but that's not the case. The second is that also because many government officers has announced that the pandemic is over. They say, oh, no, you don't have to wear masks, and you can have more people in parties and all that. So that's another feeling of relax or release that there's no more pandemic. And then lastly is because many preventive measures have been made non-mandated, like you people wear masks, social distancing, all that thing has gone by now. So, but the answer is not yet. No, the COVID pandemic is not over. And Dr. Chia has already mentioned about we are in a triple-demic at the present time, which is COVID-19, influenza, and RSV. Now, why vaccine treatment? So vaccine against COVID-19 and flu will help limit severe infections. You must remember, it's not the infection that I'll come to that later. that is killing people or making people uncomfortable. It's in severe infections that will affect your life, your complications and all that. We know there's no specific treatment for RSV at the present time, but I have heard recently, actually a couple of days ago, there's a report from Argentina says that the ordinary vaccines for ordinary virus can also prevent also treat RSV. Just a report from Argentina. Also, we know COVID-19, as you know, is developing more variants now, continuously from Alpha, Beta, until Delta, now Omicron. This is successful development of variations, variants of this virus. At the same time, people like the scientists are continuously trying to make new vaccines. Why the new vaccines? Because you have to target at the new variants. So there's a war between the viruses and the victims. The victims are the human beings in this case. Now, vaccine also significantly reduce hospital admissions and ICU admissions. It helps to save hospital and public health resources. So other hospital usage would not be affected, and that you don't have the cancer operation, you don't have take people away from the ICU treatment and all that. The question, as many of you have heard about vaccine hesitance, people are reluctant to take the vaccine for three reasons. They call 3 C's. First of all, the confidence. Many people have lost confidence about the effectiveness of the vaccine, about the reliability and competence of health services and health professionals. And finally, the motivation of the policy makers who decide on need. Why these people come to tell you, you need a vaccine, you need a booster machine, you have a booster shot, and now what you call bivalent shot. It keeps on coming, this thing. But there is a conflict of interest behind all this, because who knows what these people are thinking in their mind. They're thinking of making a lot of money, because this is, there's billions of dollars involved in this kind of business. So there's a lot of hesitance about people, why people do not want to take vaccines. Now, again, after vaccine, now it's a booster shot again. You have to understand, after regular vaccines, the effect of immunity gradually decreases in its protection against infection. Booster increases the immunity. In other words, if you get a booster, you increases your immunity. And most Omicron vaccines lost its protection after about 6 months. So if you receive a first dose, you pay probably the effect is about 6 months, you need to have a booster shot. Booster not only reduces symptoms, it also decreases severe organ damages. So as the infection becomes severe in the late stage, there are organ involvements which could be infected, including lungs, heart, kidneys, and liver, will also be affected in a large portion of people. Maybe not as bad as before. Protection improves with each additional booster dose. So that's why you have 2 doses, then 3 doses, and 4 doses. Now, the historical COVID-19 viruses include Alpha, Beta, Gamma, Delta, and now Omicron. BA.5 is the variant of Omicron, which for a while was very popular, but now it's fading gradually. Half of the cases now in COVID are now due to 2 descendants of BA.5. In other words, BA.5, that's the BQ1 and BQ11. Currently, I think the most strain in the community is BQ1. The new variants are clearly more transmissible and more infectious despite previous vaccination infections, because there are continuously new strains coming up. So what is most recently you've heard about bivalent booster, and I think downstairs we gave this bivalent booster. Bivalent booster can protect against 2 strains of COVID-19 viruses. The original strain, like Delta, and now Omicron. But this vaccine, the bivalent booster, has protection against the original strain and the Omicron variant. The bivalent booster works best against BA.5, which is the first generation Omicron. It can according to Pfizer, it can produce a 13-fold increase in antibodies, fight against the virus. BA.5 was classified as an Omicron variant, but has mutations that distinguish it from other Omicron variants. In other words, it's not only BA.5 Omicron, there are BA.1 and BA.2, but mostly, as I said, that was from BA.5 infection until now. Now, but BA.5 is the parent strain of BQ1 and BQ11. So as I said, most of the circulating virus now is the BQ1. So those who have boosted or have been boosted or infected within the last 3 or 6 months are less likely to be infected again, and certainly less likely to suffer severe disease. That's why we are suggesting the booster vaccination. This Pfizer study is that the latest booster increases the level of neutralizing antibodies against both BQ1 and BQ1.1 as well. So this booster vaccine not only works against the Delta, but also Omicron and Omicron's B5's descendants, BQ1 and BQ2. So it's pretty widely covered. So always people mention about adverse effects of getting a booster. Actually, it is not that common or that serious. First of all, the most you might get is a little bit of pain at the injection site. And there may be mild fever, and rarely people might get some headache. And generally speaking, there's not much of a safety concerns on vaccines. The instance, one of the very concerned complications is the mild pericarditis, which is involving the heart muscles as well as the pericardium, the cover of the heart. This side effect is very, very well. The benefits of vaccine is in reducing the severity of COVID-19, hospital admission, and death far outweigh the risk of development of myocarditis. I think I saw a recent British Columbia CDC that said the rate of myocarditis was about 0.97 cases per 100,000. So it's less than 0.1%, I think. And compared with normal people, it's 0.13 per 100,000 population we have myocarditis. So it suggests that all age 18 and above should get bivalent vaccine. Age 5 to 17 will, with the immune-compromised diseases, should get the boost as well. I think now it is recommended that child above 3 should be vaccinated. What happens is that the little kids, they can get infected without any symptoms. So as a result, they might be bringing this virus home, particularly if you have elderly people, grandparents, they can bring that virus to them, and they will get really sick. So it is recommended that even younger people, kids like 3 years old and above should be vaccinated. So as a person, if you should be aware of this thing, okay? When you are facing the possibility of getting COVID, if you develop cold symptoms, get tested for COVID-19. You take a test right away because the antiviral Paxlovid, this is something I'll talk about later, is a drug which you can use to fight against the virus. And this Paxlovid, you have to take, if you need to take, you have to take them early, not when they develop significant complication or serious disease. Then it's too late. I'll show you why. So if you are over 65, or if you have any disease, complicated disease, I would mention those diseases. And you should take the test right away, the rapid test, because the moment it's positive, you have to identify yourself or other patients whether they have higher risk of developing serious disease. So that's why you should test. If you have symptoms, you should test COVID right away. If you are traveling, you should wear a mask if you have symptoms. You're masking while traveling to celebrations or different kinds of functions, you should always wear a mask still. Get vaccinated against the flu and the COVID-19 together for family, for any family gatherings. Everyone should have been vaccinated against flu and also boosted against COVID-19. So what to do if you are affected? Say if you test positive for COVID-19, you should stay home for at least 5 days and isolate from other household members. You should wear a well-fitted mask around others in the house. If you have a cold or any kind of respiratory infection, or you have a fever, don't go to any kind of gatherings. You should stay home. When you are fever-free for 24 hours and symptoms improve after 5 days, you can end isolation, but take precautions for 5 additional days. This includes wearing a mask and avoiding traveling. Now, COVID is we call it biphasic disease because the symptoms at the beginning and the later is different. Moderate to severe or critical illness usually due to inflammation, while the early part of the disease is due to the virus. So early treatment in using antiviral therapy and also late-stage treatment will be So at early stage, when you treat people, if you treat people with risk factors, you should use antiviral therapy. In the later stage, antiviral therapy is no longer useful because all the disease that you happen after that is from inflammation of the virus infection. So I just want to show you this thing because I thought it should understand. So what happened at the beginning of the disease, when the virus, when you start infected, you have very asymptomatic or pre-symptomatic, no symptoms whatsoever, you got infected. So after that, the virus duplicate, and at the stage of, then when at the middle stage of mild illness, only mild illness, at that time the viral replication starts to slow down. But at that time, you become sick because of the inflammation. The inflammation causes respiratory failure. You have the oxygen saturation going down, and the X-ray will show you the infiltration in the lungs, which are part of the disease, the important change of the disease. And when you're severe, in the severe illness, the oxygen saturation is going to be down. If it's down below 95%, then you are in big trouble. Many times you will have to be go into the extend into the critical illness, where you have respiratory failure, you will need a respirator, and you may be shot. You may have a multi-system involvement. So the that's why I'm showing about the two phases. The phase one is the viral replication. The second phase is the inflammation phase. So the symptoms, the treatment are quite different. Of course, when you get to that inflammation, you have a serious illness. So this is just one picture showing, when you expose to the virus, you start to have a little bit of symptoms. It's okay a few days. But then once you are diagnosed, you can see the X-ray shows pretty clear, the black. The other ones don't worry about that. So by the time you get to the later stage, that you will have this kind of lungs that infiltrate. There's a lot of infiltrate, the white stuff. This is the serious, because all the things they clog up or destroyed by the virus. So that is a critical period. This was in Chinese Center for Disease Control and Prevention during the at the beginning in February 2020. They showed the mild cases were 81%, and severe cases is 14%, 5% critical. But I think now most people infected belongs to the mild cases. I would suspect probably 95% are mild cases, but then 5% will be severe and critical cases. Again, this is very important. I think you should remember that the spectrum of the disease is mild, moderate, severe, and critical. Again, the critical is the failure, septic shock, or multi-organ dysfunction. So the management, again, at the beginning, could be, you could use, it's probably too late now. How long after? Oh, 5 o'clock. Okay, these are the things you should remember about risk factors. If you have infected, you prove that you have infected, then you should find out whether this person or yourself was infected. The risk factors are the factors that will influence you that eventually develop severe COVID disease, COVID-19. So if you're age over 65, if you're pregnant, if you have underlying comorbidities, which are all this stuff, and prior stroke, if you have previous cancer, you are used any significant immunosuppressive medications. Those are risks. These are the belongs to the comorbidities. If you have diabetes, if you have chronic kidney disease, you have a chronic lung disease, you have a cancer and the use of chemotherapy. If you are overweight is very important. Chronic liver disease and cardiovascular disease, including hypertension. If you are affected by COVID-19 and you have all these factors in it, then you are in the higher risk person, a high risk group that might develop severe COVID infection disease. So the risk of serious disease increases from age 55. Age above 85 is 300 times more likely to die. If you have overweight, obese, you are at risk. If you have cardiovascular disease, diabetes, chronic lung disease, you are 6 times more likely to be hospitalized and 12 times more likely to die. So if you have any of these risk factors got infected in the early stage, you should try to seek for treatment. As I said, today's treatment is Paxlovid, okay? So the stepwise approach of management is establish a diagnosis with rapid antigen test, which everybody has at home. You have a clinical stage the patient. You should stage the patient as mild, moderate, and severe. And you try to keep them in the mild stage. So you treat them early if you have those risk factors. And then you have to try to do the oximetry to see the oxygen saturation. If it is anything below 94, you should probably go to the hospital. And as I said, you should determine the presence of a higher risk conditions as we have just read. Then we will start the appropriate therapy according to the stage of the disease. So what are medical treatment? Of course, symptomatic treatment at the beginning. If you have fever, pains, aches, cough, and sore throat, you just use the common medications. Paxlovid is the most commonly used therapy for non-hospitalized patients. It should be started within 5 days of initial symptom. It is 80% effective against COVID-19 viruses to develop into severe disease. So you keep them in the mild disease. There has been talk about a rebound symptoms of using Paxlovid. I think somehow the virus, after you kill them at the beginning, but somehow they came back. It is usually a mild form of disease. It does represent the virus are coming back. The patient becomes contagious again, and the patient needs to be isolated again. So for a time, people have been using monoclonal antibody. But it's not a drug of choice now, as it has a very limited range of effectiveness. No monoclonal antibody treatment for COVID are available in the States now. Omicron's many subvariants render the drugs less effective. The drug is not expected to neutralize Omicron subvariants BQ1 and BQ11. So the big problem is that monoclonal antibodies bind to a very small piece of the virus. It doesn't really kill the whole virus. Another one that people always worry about is the long COVID symptoms. Prolonged persistent symptoms or new symptoms that develop or continue at least 4 to 8 weeks after COVID-19 infection. 10 to 30% of people infected with COVID-19 will experience lingering symptoms after COVID, which includes fatigue, brain fog, breathlessness, headaches, sleep disturbance, and exercise intolerance. So this is what, unfortunately, we don't have any time for question. Okay, we will have, Dr. Chow, you want to answer some questions?
Thank you very much, Dr. Chia. Now it's a question and answer period. You can ask in English, Cantonese, or Mandarin. Any questions that perhaps Dr. Cheung can answer in Cantonese? Yeah. Yeah. Okay. Yeah, okay. Is there any question from any of you? 有冇問題啊？如果係有問題咧，張醫生同埋 Dr. Chia 佢哋可以用英文、國語或者廣東話答嘅。
冇怕醜，舉手邊度有問題嘅？
嚇。Thank you for attending. We have some refreshments at the back there, so please feel free to go and have a piece of cake. And also you can ask questions if you have questions for Dr. Chia or Dr. Cheung, please feel free to ask. And we will hand out the IPF booklet to all of you. Thank you. We will still be having these seminars following. Probably in February, we'll have another one, with, hoping that you can continue with more details. Yeah. Thank you.